So thanks to the increased recognition of hidradenitis suppurativa and a better understanding of what's causing the disease, we're seeing great progress being made in terms of the therapeutic options available for patients. And that's not just things like medical therapy that we're seeing an improvement, but also the way we manage the patient as a whole. So there are advances in things like psychological support for patients, lifestyle modification, but also we need to address the wounds that these patients have. And there are often a sort of a dying breed of wound specialists out there who can help appropriately manage and advise on wound management strategies. So it's great for us to see that there are HS-specific products coming to market, such as HidraWear, and certainly it's something I advocate for my patients. It's not just a means of holding their dressings in place without causing problems with adhesive tapes and so forth, but it's also reducing the friction that we know can propagate the disease as well.
It is difficult with dressings, as we know, and I mean, there is ideal, there's amazing dressings out there, and HidraWear is fantastic with what they offer, and it just makes sense because there's nothing worse than a patient coming in with being told to wear sanitary towels on the wounds, men and women, and to cut these net pants as well. It's really traumatic if anyone's ever tried that. So HidraWear is fantastic. It makes sense. It's got the the air holes in, the dressings fit, it's comfortable. It's actually quite, I would say, trendy even for patients to wear it. There is an amazing innovation in a wound care product called HidraWear, and it's within it's a garment, it's clothing, where the dressing pad, a super absorbent dressing pad, is fixated into the dressing, so it retains it absorbs the exudate, it's kind and gentle to the skin. So we need this system to be recognised more throughout the NHS and in primary care, and added into wound care formularies. There is a data study on this, a research study about how it affects their quality of life, and it has improved greatly. People telling us that, well, we can go out for dinner, with our friends or with our partner, which they've never done before, in the secure knowledge of going to school, university, into the workplace without worrying, oh, my dressings are going to leak, it's going to come onto my clothing, or something's going to fall out.